Hello everybody, I'm back. Dr. K.K. Agarwal, President, Confederation of Medical Association of Asia and Oceania, past National President, IMA, and President, Heart Care Foundation of India, and you are watching Medtalks with Dr. K.K. This is going to be a 202nd non-stop edition with 1,614 COVID episode. Let's have the headlines of the day. COVID treatment protocol has had the unintended consequence of detecting lung cancer and lung TB in many people who were unaware of their condition. Andhra Pradesh records less than 100 new coronavirus cases. IMA demands panel to study data of deceased doctors due to COVID-19. India gives 4 million COVID vaccine doses, but pace slower than expected. UK minister has said that there are 4,000 variants of coronavirus that causes COVID-19. And the coronavirus spike protein, every amino acid has mutated at least 4 times. Before I introduce you to the special guest, let's have first the topic of the day. Today is World Cancer Day, so we will understand more about the cancer. And before I introduce you to the special guest, let's do our ritual of Atithi Devo Bhava. कभी भी किसी अतिथि को बुलाते हैं तो सबसे पहले अपने हाथ धोते हैं, फिर उसके हाथ धुलवाते हैं सुमन के द्वारा. S फॉर सीधा, U फॉर उल्टा, M फॉर मुट्ठी, A फॉर अंगूठा, N फॉर नाखून, and K फॉर कलाई. Once we have done that, we are ready to introduce our special guest. And this time, our guest is Dr. Sajeev Anand, a board-certified practicing medical oncologist, hematologist in the Washington, D.C. metropolitan area in United States. He has had a vast experience in treating solid tumors and hematological malignancies over a span of over 30 years. Dr. Anand has several awards and honors to his name, including being an ex-chief of medicine and oncology at Luminous Health System, a big area health network consisting of 2 large hospitals and several peripheral healthcare facilities. Sajeev has also been the president medical staff at the Doctors Community Hospital, now part of Luminous Health System. He is also a member of many medical societies, including American Society of Clinical Oncology and American Society of Hematology. Besides many other, his areas of interest in the medical field include management of breast cancer and sickle cell disease. And whenever he finds time, he is an excellent singer. Maybe if the time permits, we will like to listen and compete with the original Manade. Thank you, Sajeev, to be here with us. Today is World Cancer Day, and what message you want to give on this World Cancer Day. But before that, I want to ask you a simple question, that cancers can be either due to oxidative damage or of the DNA or the mitochondrial DNA, or they can be because of underlying chronic inflammation. And those cancers who are due to underlying chronic inflammation, we feel COVID may also precipitate underlying chronic inflammation, exacerbate underlying COVID inflammation. Do you think that this COVID-19 in some cases will precipitate underlying malignancies linked to chronic inflammation? Sajeev.
Thank you first of inviting me.
ये बंद नहीं करिए रितु.
Happy World Cancer Day, and let's all work together and defeat this dreadful disease, especially with the fact that almost 2/3 of cancers are preventable. So thank you very much, Dr. KK, for inviting me. Now, in regards to the question which you have asked about the inflammation, I think it's a very important aspect, because lots of, quite a few cancers are actually associated with inflammation. Just to name a few, there's a kind of a lung cancer called pleural mesothelioma, which happens because of asbestos exposure, and that, can cause a significant of inflammation, which changes the cells. Also, patients who have chronic, infections of the lung, that has been implicated to cause lung cancer. Same thing with people who have issues with the bad teeth or gingivitis. Again, that inflammation has been incriminated to cause cancer, and essentially there are a lot of different parameters, which a lot of different things that are happening with inflammation. A lot of these inflammatory modules like tumor necrosis factor alpha, interleukin 2, interleukin 6, interleukin 8, 10, they all can actually not only can cause direct DNA damage, to cause cause cancer, but they can also work through other mechanism, a mechanism of epigenetics, which I'll be discussing later. Now, one cancer which I really forgot, which has been associated with inflammation, is colon cancer, which happens because of patients who have inflammatory bowel disease like Crohn's disease and ulcerative colitis. So inflammation plays a big role in causation of cancer. Now, in regards to COVID, in COVID, there is a lot of inflammation going on for several reasons. And, we don't necessarily have to go into those reasons, but all that inflammatory parameters, down the road, can have the potential to cause different kinds of cancer. Although right now, we don't have any substantial evidence because this is too premature at this time.
So what I'd like you is to give a short presentation and on the current scenario of cancer and what's new, and then we will interact with each other.
Absolutely. I will use the PowerPoint. So Ritu, are you ready? So let's talk about understanding cancer. Next, please. So this year's theme is that I am and I will. Next. So let's talk about what numbers tell us. There are, next, okay. So what is the situation? What is the gravity of situation? The gravity of situation is that over a lifetime, 1 out of every 2 women and 1 out of every 3 men will develop cancer. And that is a big magnitude which people don't realize. Next. Now, half of the patients who are diagnosed will die of their cancer, and majority of these deaths are occurring in the developing world. In the developed countries like United States, we are able to save almost 75% patients from cancer with new modalities of treatment. But this thing has not reached yet to the developing countries. Next, please. So these are the common cancers: lung cancer, breast, colon, prostate, stomach, and skin cancer. Next, please. In this order, yes. Now, as I said initially also, that 2/3 of these cancers are preventable. So we got to talk about what are we doing wrong which is causing so many people to develop cancer, and what can we do to prevent cancer? Next, please. Next, please. So let's talk about the roles of genes. It's very important to understand the roles of gene in cancer because genes are causing cancer. So there are inherited cancer genes. 5 to 10% of cancers are from inherited, can get inherited. And these inherited genes are also called tumor suppressor genes. And their role, they are just like brake pads of a car, basically. What they do is they will not allow any you know uh, any defects that are happening in cancer, and what they do is they will correct those defects. And some of these inherited cancers like BRCA1, BRCA2, PALB1, ATM, just to name a few, have been incriminated to cause hereditary cancer. So these are more like germline mutations, means that they are inherited to the offsprings. And there are a lot of cancers which are inherited through cancer suppressor genes, namely breast cancer, ovarian cancer, prostate, colon cancer, and cancer of the pancreas. Now we have drugs actually which can repair those genes, which which is not happening because of mutations in the genes which I just mentioned. So those can be directed against these inherited cancer genes, and they can switch off and repair those mutations. And I'll discuss more that in later. Next one, please. And then there are acquired genetic mutations. So what's happening here is that we have to understand what gene is. Basically, gene is all our cells of the body. They have a nucleus, and in that nucleus there's genetic material, and that genetic material is composed of genes, and gene is a one part of that genetic material which can independently produce a protein. So most of the acquired genetic mutations are happening because of all the carcinogens which people are taking, and we'll discuss more about that. And to name a few genetic mutations which are happening as an acquired are HER2 new mutation, which is which we see in breast cancer, epidermal growth factor receptor, EGFR mutations, the ROS mutations, and they are responsible for so many different kinds of cancers. Essentially, what they're doing is that these non-mutated oncogenes, which are actually called proto-oncogenes, are responsible to make sure that the unrestricted growth does not take place. And so when there are these mutations, cancer can have potential to grow in an unrestricted fashion. So now we have drugs, called targeted therapies, which are specifically targeted against these genes, which can actually prevent cancer, which can reduce cancer. So this is a very important concept. Next, please. Now, what is the role of epigenetics? It's very important to understand this, that our entire genome basically is kind of wrapped up on proteins which are called histones. It's just like, you just take a woman who has long hair and she has curlers which are holding those hair, basically. So that's how. So what's happening is that there are some switch ons and then there are switch offs, basically. Why somebody has a color, white or black, and why somebody is tall or short, it all depends upon when in their lifetime, some genes are getting switched off and some genes are getting switched on. The switched off genes are called, the genes which are responsible for switching off are called acetylators of, of our genes and the histones, and switch on genes are called methylators. So this is a very important concept to understand, because lots of cancers, especially on the side of hematological cancers, leukemias, lymphomas, and some other solid tumors, basically they're not causing any mutations in these genes, but what they are doing is they have made the switch defective. So that switch, which will cause the the stop of the functional gene, gets defective, it's not working. And so there's more hypermethylation going on, which can result in cancer. And there are a lot of cancers, as I said, which work through this way. And now we have anti-cancer, these switch medications, which can actually make the switch operative again. These are again called targeted therapies, and they are very important in switching off these genes, essentially. Next one, please. Next one. So these are the commonest cause of cancer. Obesity has been linked to inflammation, and if you look at the numbers, the per capita consumption of calories and fat has been linked, in a direct proportion of a country as far as the cancer is concerned. So we must want to maintain our weight, in a proper body mass index. Next, please. Tobacco use. Tobacco can cause 38 different kinds of cancer, right from your lip to the anus. So how do tobacco work? Tobacco basically causes DNA damage. The carcinogens in tobacco cause DNA damage. So all these cancers, starting from the lip, oral cavity, esophagus, lung, gastric, colorectal, pancreas, breast, all these, have been incriminated, just to name the few, but there are 38 cancers, leukemias, that have been linked to tobacco use. Next one, please. Alcohol, again, lots of cancers are caused by alcohol, again, related to cancer of the oral cavity, cancer of the pancreas, cancer of the liver, colorectal, just to name a few. Breast. People say, oh, well, drinking a glass of wine does nothing, but drinking a glass of wine in a woman increases their breast cancer risk twice. So women who have already had these inherited mutations, should absolutely refrain from alcohol use. And alcohol, how does it cause cancer? Alcohol is, in the tissues, it becomes aldehyde. As you know, a lot of people, drink methyl alcohol, it becomes aldehyde, and there's no way to escape this aldehyde because body does not have any mechanism to remove it, and these aldehydes are responsible for causing these cancer mutations. Next, please. Infections, all different kinds of infections can cause inflammation, causing cancer. Just to name a few, one of the cancers, lymphoma of the stomach, is caused by Helicobacter pylori, which can actually get completely cured after eradicating the infection. Then different viruses can cause cancer, including hepatitis B, hepatitis C, which is incriminated to cause liver cancer, and other cancers, which are, and there are several other cancers, that virus which causes infection mononucleosis, that also has been responsible to call different kinds of EB virus has been shown to cause lymphomas. So they all are acting through the inflammation, and inflammation is now talking about the inflammation. Now it's very important to understand, how cancer is using inflammation to its own benefit. Cancer creates lots of time a response of inflammation around it, and would not allow the other cells which are trying to eradicate the cancer to come and help. So it is creating an atmosphere of inflammation around itself, and that helps it to grow and metastasize as well. Next, please. Radiation exposure, again, very important. Radiation, which we're getting from ultraviolet radiation, Sun exposure is responsible for a lot of skin cancers, including melanoma. Other radiation exposures, like patients who have had prior radiation, say, for example, for different kinds of lymphoma to the chest, they can down the road get uh, tumors like sarcomas and breast cancer. So radiation, also with all these, CAT scans, other things which we are doing these days in more and more fashion, that also include cause more radiation exposure, and a significant number of those that kind of radiation exposure also increase now and being incriminated to cause cancer. Next, please. Chemical agents, arsenic, lead, they have been, incriminated to cause cancers like lung, kidney, bladder. Next, please. Inflammation and cancer, we already talked about, so I'm not going to allude to that again. Next one. Next, please. So what we need to do, we need to change our diet. Obesities cause all different kinds of inflammation. So, stop eating starches, stop eating fat, stop eating too much sugar. Get your diet that includes fruit, vegetables, tofu. People have a lot of issues about tofu. Tofu is actually has a cancer prevention properties. Basically, the estrogen content of tofu is very, very small, and it helps prevent cancer and not cause cancer. So this is very important aspect to understand. Those small amount of estrogens basically will not cause cancer stimulation. Although if patient already has breast cancer, I believe they should still refrain from tofu. But in normal population, tofu is an excellent source of vegetable protein, and we must include that in our diet. And low physical activity, exercise always helps cancer by reducing inflammation. Next, please. Now let's talk about the treatment. Surgery is still a mainstay of treatment of cancer. Early cancers can be cured by surgery. We talk about lung cancers, pancreatic cancer, intestinal cancers, colorectal. When they are early stage, they can be cured surgery. So surgery still has a major role to play. Next one, please. Radiation treatment, absolutely. A lot of cancers can be controlled with radiation. Some cancers of the throat can simply, all they need is radiation. But especially radiation can be combined with chemotherapy and certain immunotherapies now, which can also cure cancers, including cancer of the colorectum, some certain forms of lung cancer, etc., etc. In radiation, there's also new concept of what we call as proton treatments. Protons are specifically designed to only act on the cancer cells. So if somebody has had pre-existing radiation, they've had maximized their radiation dose, they can still be treated with proton treatments. Next, please. Chemotherapy still, although chemotherapy's role is getting more and less and less now, but chemotherapy still is utilized in a lot of early stage of cancer treatment. Some cancers can be, can be shrunken with chemotherapy and radiation, plus minus radiation, like breast cancer, lung cancer, and then surgery can have a role to treat them. Next, please. Now, immunotherapy is a new concept, and it is rapidly catching up with the treatment of cancer. So what's happening in immunotherapy? Just try to understand. Cancer cells and other body cells, they carry certain proteins called ligands. These ligands, like one of them is PD-L1, programmed death, inhibitor ligand. And the role of these ligands is to suppress the immunity so that immunity cannot kill the cancer cells, So now we have drugs, antibodies against these ligands, which can go and attach on these proteins and would not allow their immunosuppression to work. So body has now lots of immunotherapy in its hand, which can kill cancer cells. So this immunotherapy now is being used in a lot of different kinds of metastatic cancers, and also it's catching up in the early stage of cancers like breast cancer and other cancers, lung cancers, in which it has been shown to be superior than chemotherapy. And then one of the other type of immunotherapy is what we call as CAR-T, C-A-R-T. CAR-T Immunotherapy, in which what you're doing is you're taking the immune cells out of the body, basically, and just priming them with the antigens which are present on the cancer cells, just like, I mean, like an arrow which is now primed to hit a target. Then you reintroduce these cells in the body, and now they are going to go and target the cancer cells and kill cancer cells. This has been shown to have very important implications in treating different kinds of hematological malignancies, including some forms of leukemias and lymphomas as well. Next, please. Targeted therapy, again, I'm going to be short. Targeted therapy, I already talked about, targeted therapy can be targeted against these genes, and target therapy can also be targeted on those antigens which are present on the cells. And some of these targeted therapies, which we combine as anti-gene therapy and anti-molecule therapy, basically now are curing cancers. A lot of cancers, chronic myelogenous leukemias, chronic lymphocytic leukemia, which we never thought will get ever cured, are now potentially cured. And that's where we have developed now a concept of minimal residual disease. We always check minimal residual disease and follow minimal residual disease to follow and see when is the time to stop the chemotherapy or stop these targeted therapies altogether. Next, please. Yeah, so I mentioned about target. Some other targeted therapies are there, which actually cuts the blood supply of cancer, like anti-angiogenesis drugs, which are being used, and then many others, which we can discuss some other time. Actually, any of these things can be a separate topic to discuss. Next, please. Next, please. Yeah, we talked about those things. Next, please. So what do we do for early detection and prevention? Very important, colonoscopy. Everybody should have a colonoscopy. Now that the age has been reduced to 45 years because we are seeing a lot and lot patients, younger patients now. And as I alluded earlier, patients who have risk factors like family history of cancer or inflammatory bowel disease, they should start having a colonoscopy much earlier. Next, please. Annual mammogram after 40 years, and if somebody has those inherited genes which I mentioned, BRCA1, BRCA2, lot earlier, has shown to significantly reduce significantly have these cancer get detected early and significantly reduce mortality. Next, please. Okay. Rectal examination PSA starting at the age of 50 for normal men and 40 for patients who have family history of prostate cancer. Next, please. Yearly CAT scans in smokers, again, very important, what we call as zero CT scans. They can, help with early detection, and they can actually impact the survival in a positive way in smokers. Next, please. Prophylactic mastectomy, removing breast, and salpingo-oophorectomy, removing ovaries and tubes. Again, as I mentioned, BRCA positive patients, inherited cancer, those cancer suppressive genes. Basically, breast cancer can occur in as many as 80% of these patients, and ovarian cancers as many as 50% of these patients. So we should seriously consider getting a prophylactic mastectomy. Angelina Jolie here, got all these things done. Salpingo-oophorectomy also, once they have, finished their reproductive age, they should consider getting a salpingo-oophorectomy as well. Next, please. So myths and misperceptions: artificial sweeteners do not cause cancer. That's just a myth. Next, please. Surgery or biopsy can cause cancer spread, but the way that surgical techniques are, that is happens very, very unusually. So if there is a surgery is an option, a person should not delay it, thinking that, it will cause cancer spread. Next, please. Herbal products can cure cancer. If that was the case, Baba Ramdev will be the most successful oncologist in this world. That's not the case, but certain products like ginger, mushrooms, those are the kind of things which have been found to reduce inflammation and help cancer. Next, please. Hair dyes, yes, temporary hair dyes do not increase cancer risk, but permanent hair dyes can increase cancer risk, and DOs do not increase the cancer of the breast, but talc has been implicated to cause cancer of the ovary. Next, please. Treatment has to be started immediately. No, cancer is not something which grows, except for few very highly mitogenic cancers. Otherwise, treatment, we can have enough time. These things don't grow in days. It takes months, most of the cancers, to grow. So we should give ample time, to have all the investigations come and then decide what is the most appropriate treatment for cancer. Anything else?
Thank you. Another
Please.
slide. Another slide.
Cancer is not a death sentence. As I said, 75% of cancers are curable. 2/3 are preventable just by changing our lifestyle and stopping smoking and alcohol. So it's not a death sentence. Thank you.
So I want to come back to some question answers. I want to go back to, again, the concept of chronic inflammation. That's my imagination, that apart, because smoking, I agree, alcohol, I agree. Radiations in a country like India, you may not be able to reduce. Pollution, you may not be able to reduce. Pesticide, insecticides, you may not be able to reduce. Many things you may not be able to reduce. So I would say that oxidative stress is something you may not be able to reduce. But at least you can reduce this chronic inflammation and bring your CRP to less than 0.65 as much as possible. And there are situations where you can reduce IL-6, IL-1 beta, you can reduce TNF alpha. All these things you can reduce and try to reduce the inflammation. So I'm going to come back to when the inflammation is getting controlled. How do we try to identify immune check inhibitors, whether it is PD-1 or ligands? Are we going to depend only on the US, which are very, very, very costly? Every day they are coming. How to find out a lateral thinking, come back with some research and find out natural sources of checkpoint inhibitors? Is it possible?
Question, and unfortunately, I don't have an answer to that. I think these checkpoint inhibitors can be checked by measuring their PD-L1 levels in the blood, which is not a very elaborative test. By checking the PD-L1, what is the percent of cells which are carrying this PD-L1, one can make a decision whether to use immunotherapy or not in these patients. Now, in regards to, you mentioned very important point about C-reactive protein, and that's a very important concept. Actually, I came across a study from Denmark in which they took 70,000 normal individuals and checked their CRP and followed them over a period of time to see what was their risk of cancer. So if the CRP levels are double or tripled, they have higher risk of developing lung and colorectal cancers. And also, when they develop, and patients who had cancers, if they had high CRP levels, they had 80% higher chance of dying from their cancer. So CRP is certainly a very, very important aspect in cancer as well.
So CRP is directly related to TNF, that is tumor necrosis factor alpha. It is also related to IL-1 beta, IL-18, whether it is using the NLRP pathway or nuclear factor kappa beta pathway, or it is using the TH1 pathway exaggerated. And all these pathways are linked to tumor inflammation. Ultimately, if you increase the tumor inflammation or you have a reaction with the checkpoints, and the coordination of that, if there is an incoordination, you may end up into a cancer. I come back to another thing is that I was following lung cancer, and they have taken the lung cancer tissue, irradiated it, and then they used it as a lung vaccine. So what is the concept of using a patient's tumor and converting that tumor by eradicating. See, we take the virus, we kill it, irradiate it, and we say it's killed vaccine. Okay, see, this rabies vaccine is a killed vaccine, and this vaccine, Covaxin in India and Sinopharm in China are killed vaccines. Are there some studies which talks about converting tumor vaccines by taking the tumor tissue?
Yes, a lot of studies going on, but this concept is still at a preliminary stage, and there are no approved cancer vaccines at this point in time. I believe the role of vaccine is more in the field of preventive, where where women should get HPV, human papilloma virus vaccines, and also get immunized with hepatitis B virus, because these can cause cervical and liver cancers. But the role of cancer vaccines is emerging, but rapidly emerging field. But at present, there are no, and there are a lot of cancer vaccines in trial right now, but none in practice, to my knowledge, at this time.
I'll come back to HPV. But before that, I want to share one anecdotal example. मेरे पास में एक 30 साल की लेडी थी. She had AML, acute myeloid leukemia. गरीब औरत थी, सर्जरी, कीमोथेरेपी सबके लिए उसने मना कर दिया. The husband said, let her go peacefully. The oncologist said she has a week to survive. हमने उसका ब्लड लिया, ब्लड को इरेडिएट किया, हमने पहले उसको इनएक्टिवेटेड वैक्सीन बना दिया उसका. हमने उसके ब्लड का थोड़ा सा ब्लड लेके उसको अल्कोहल में डाल के हमने उसको इरेडिकेट कर दिया. आई मीन उसको किल्ड वैक्सीन बना दिया, उसको डाइल्यूट कर करके किल्ड वैक्सीन बना के उसको ओरली दिया. आई एम टॉकिंग अबाउट ओरल. आई सेड एनेक्टोडल. The myeloid leukemia disappeared. So there was, I'm talking about 20 years back. And at that time, the pathologist came, he says, not possible, तुमने पहले किसी दूसरे की slide दे दी होगी. Slide misplaced हो गई होगी. How can a AML disappear? Anyway, patient went, came back after 3 months, and she had a relapse and died. But that relapse we saw, and तब से मेरे दिमाग में घूम रहा है कि ये जो कैंसर वैक्सीन हैं इस पे कोई रिसर्च नहीं कर रहा. द रीजन बीइंग इसमें कोई इंडस्ट्री नहीं है जो हेल्प करेगी. दीज आर पेशेंट स्पेसिफिक कैंसर वैक्सीन. ऐसा कुछ हो सकता है क्या? लेटरल थिंकिंग.
That very important concept, and what you're describing and what I described when I talked about epigenetics, which are just switch on and switch off switches, basically to switch on a gene. Mutations nahi ho rahi hain usme. So it's very possible that whatever you introduce basically somehow switched off that gene which was getting more proliferative, getting hypermethylated, and was expressing as a. तो हो सकता है कि जो switch जो था वो उसको देने से जो है वो switch जो था उसका off हो गया. This is very, very possible. But certainly, I think cancer vaccine is another, as he said, is a very important field. And perhaps we can come back and discuss in more detail about cancer vaccine down the road sometimes.
छोटी सी चीज वो है HPV का आज की डेट में प्रोटोकॉल क्या है अमेरिका में और क्या प्रोटोकॉल होना चाहिए. बिकॉज इंडिया में इतना प्रमोशन होने के बावजूद भी ये टॉक ऑफ द टाउन अभी नहीं बना है.
ये बहुत ही अनफॉर्चुनेट चीज है. when a woman gets into the reproductive age, she should, in America, just around 13 years or so, she gets this vaccine. We call it Gardasil, and it has shown to significantly prevent HPV 16 and 18, I believe, which are the most cancer causing viruses. So it's and of course promiscuity has something to do with which HPV infection, but that's not the only thing. I mean, HPV can be यहाँ पे जो है, I mean, a lot of people they don't have they're not that hygienic, so that also can sometimes introduce HPV infection. So my understanding is that any woman as soon as she enters the reproductive age, should have an HPV vaccine.
गाना सुनाओगे?
गाना सुनाओगे?
So I thought before I close, let's have one or two songs.
Okay. Thank you for that. I haven't practiced for some time, but let me see what I can do. Please give me.
I want to dedicate these songs to the World Cancer Day, all the cancer survivors, all the cancer sufferers, जो इस वक्त में let them relax, let them enjoy life. So all those people, either you are suffering from cancer or you are a cancer survivor, these songs are for you.
Gamadhani saga gamaga sanida saga gama. तुम बिन जीवन कैसा जीवन, तुम बिन जीवन कैसा जीवन, फूल खिले तो दिल मुरझाए, फूल खिले तो दिल मुरझाए, आग लगे जब बरसे सावन, तुम बिन जीवन, रूठे तुम जब से पिया, सुना सा है मन का डेरा, बैरी है दुनिया, बैरी है दुनिया, बाटे कोई क्यों दुख मेरा, अपने आंसू अपना ही दामन, तुम बिन जीवन कैसा जीवन, फूल खिले तो दिल मुरझाए, आग लगे जब बरसे सावन, तुम बिन जीवन. बहुत बहुत शुक्रिया.
तुम बिन जीवन कैसा जीवन, सारे कैंसर पेशेंट जो इस प्रोग्राम को देख रहे हैं, नहीं देख रहा है तो उनको पास ऑन कर दो, उनको शेयर करो. तुम बिन जीवन कैसा जीवन के दो मतलब है. एक मतलब ये भी है कि अगर इफ यू अटैच योरसेल्फ टू योर कॉन्शियसनेस, टू योर हार्ट, शिफ्ट योर अवेयरनेस टू योर हार्ट और अपने दिल से दोस्ती करो, वो भी कैंसर हीलिंग में फायदा करता है. बिकॉज मेंटल स्ट्रेस ऑल्सो रिड्यूसेस ऑक्सीडेटिव स्ट्रेस and also reduces inflammation. That tum can be your at the level of mind, at the level of lust, जिसको आप याद कर रहे हो, जो sympathetic inflammation बढ़ा रहा है. और that tum can also be your parasympathetic state, आपका दिल, आपकी शांति, जो आपके कैंसर को कम कर सकता है. That's all, because समय कम है, दूसरा गाना हम नहीं कर पाएंगे. So फिर भी जाते जाते दो लाइनें दूसरे गाने की सुना दो, पूरा नहीं तो.
एक मिनट, मैं आपने अब कहा है तो मेरे को थोड़ा सा कुछ ढूंढना पड़ेगा। 1 मिनट अगर आप मेरे को देंगे तो तू मेरा सफर, तू ही है मेरी मंजिल, तेरे बिना गुजारा है दिल है मुश्किल। तू मेरा खुदा, तू ही दुआ में शामिल, तेरे बिना गुजारा है दिल है मुश्किल। मुझे आजमाती है तेरी कमी, मेरी हर कमी का है तू लाज़मी। जुनून है मेरा, बनूं मैं तेरे काबिल, तेरे बिना गुजारा है दिल है मुश्किल। थैंक यू।
Thank you,
थैंक
Sajeev.
यू।
Let me thank Sajeev to be here with us, and specifically early in the morning, getting up in Washington, D.C., participating in a program. मीठी मीठी नींद हटा के और आप हमारे इस प्रोग्राम में आए, बहुत बहुत धन्यवाद. That's all for today. We will be back tomorrow 7 p.m. with another show. Keep watching Medtalks with Dr. KK. Thank you, Sajeev, and thank you everybody who are watching this program. See you tomorrow.